Hello, my name is Melody Rose. I'm a student at Duke University School of Nursing in the Doctor of Nursing Practice program. Welcome to my advocacy video about cloud computing in healthcare, health information exchange, and patient portal. Traditionally, our healthcare records were created with paper and pencil and stored in boxes, on shelves, and in warehouses. Today, our healthcare records are recorded electronically and stored in files on computer servers. Because these servers can be located anywhere, we refer to the location as in the clouds. What exactly is the cloud, and how does this affect the patient? Well, cloud technology simply means information is stored via the internet on a remote server. The benefit of cloud technology is that information stored on the cloud server can be retrieved from any place that has internet access. To retrieve information, one only needs a device capable of internet connectivity, connectivity to the internet, and the required access for the desired information. Why are we going to cloud technology? The need for information to follow patients wherever they go has been identified by multiple government agencies. The platform of an electronic health information exchange, an HIE, has been created to fill this need. The Office of the Department of Health and Human Services has led the process of establishing the essential building blocks that will support HIEs. Key stakeholders of the HIEs include doctors, nurses, hospitals, provider offices, clinics, insurance companies, reporting agencies, pharmacies, and most importantly, the patient. How do patients access the HIE? The patient portal is the patient's entrance into the HIE. A patient portal is an electronic doorway for the patient to enter an internet environment that stores information specific to the patient. In most instances, the patient's physician or hospital provides the information necessary to connect the patient with their own information. How does a patient portal benefit the patient? Well, first, participation in a patient portal gives us a voice in our own health care. We become engaged in our health at all levels of both prevention and treatment. Through a patient portal, we can access our health information 7 days a week, 24 hours a day from anywhere that offers internet connectivity. We can build our health history by recounting past medical events. We can interact with our physicians, providers, and even pharmacists through electronic messaging. We can schedule and modify appointments within reasonable time frame, and we can review results of our tests and procedures. We can view patient education put on the portal specifically for us by the physician and providers, and also find up-to-date health care resources. We can share our own information with our family and friends if we want to. The patient portal takes a patient-centered approach. With the patient at the center, data collection begins and is stored, creating a bigger and more comprehensive picture of health history and needs. By encouraging participation in electronic health information exchanges, the Office of the National Coordinator expects to see a redesign of the health system process resulting in highly efficient and effective care delivery. They also expect that management of certain patient populations will lower the cost of care, increase quality of care, and improve patient satisfaction. Patient care will be driven with the use of evidence-based decisions made at the point of care and delivered through an integrated workflow process. What is in a health history? A patient's health history should include significant health events throughout life. Examples would be illnesses, measles, mumps, rubella, chicken pox, things like these. Did you have these childhood diseases, or did you receive an immunization for them? Surgeries. Do you have your tonsils, your appendix, your gallbladder? Have you had hernia surgeries or biopsies? What were the events surrounding the surgery? How about injuries? Any broken bones, accidents? What were the circumstances of the injury? Allergies, do you have any? Are they food allergies, drug allergies, or environmental? And what happens when you're exposed to the allergen? These are the types of information that should be recorded in your health history. How does my current health information get into the patient portal? Well, electronic documentation from your primary care physician, consulting physicians, clinics, hospitals, ambulatory centers, and pharmacies will automatically transmit information to the patient portal for you. What happens if I move or change doctors? Your patient portal information is stored in a cloud format. If you physically move or change physicians, your personal information is going to move with you. This is the cloud part of the technology. So let's review the benefits of cloud technology and the use of the patient portal using 5 scenarios. Scenario 1, routine doctor visit. At your annual health exam, the care provider orders blood work as a routine part of the exam. Today, you would receive the results of the blood work through mail or telephone calls. Through the patient portal, the results will be available to you and the provider as soon as they are resulted online. Scenario 2, emergency department visit. You've been involved in a car accident and transported to the nearest ED. With your consent, the ED physician can access your health history through the HIE. Retrieval of this information saves valuable time for treatment and provides important information that would otherwise have to be collected at the bedside. Scenario 3, vacation illness. While on vacation out of town, you have an illness and seek treatment through a local provider. With your consent, the local provider can retrieve your health history and provide current treatments to resolve your vacation illness. This treatment will also be recorded in your electronic health record. Scenario 4, travel. The travel scenario involves a patient that has routine treatment needs, such as infusions or hemodialysis. The patient can make arrangements for treatment in advance, allowing a greater freedom of travel while maintaining treatment. Scenario 5, my mother. For those of us with elderly relatives, the patient portal provides current and accurate information. With Mom's permission, I have access to her patient portal. I can review her current treatment and we can talk about her course of treatments. We can also leave messages for physicians and private providers if we have questions. Because my mom lives in a different state, I rely on her patient portal to provide accurate information. This helps me help my mom. We have reviewed cloud technology that includes the Health Information Exchange and the Patient Portal. The Patient Portal is meant to connect every member of your healthcare team electronically, including you. This gives you the ability to actively engage in your own healthcare. Ask your provider what patient portal he or she subscribes to and become part of the cloud technology.